Hi, I'm Dr. Mel Crane. I'm a Senior Research Fellow from the University of Sydney. I'd like to acknowledge the Darug people as the traditional owners of the land I'm speaking from today. In this talk, I'd like to share some research I've been investigating on the impacts of working from home on health. The past few years have proven that many jobs can be done from home, and for many it looks like the future of working from home is here to stay, at least in some form. Internationally, large companies including Twitter and Spotify have switched to fully remote, while others such as Google and Ford have gone for a hybrid flexi-teleworking model. In Australia, many small businesses have sold up their office space and moved to remote working, while large companies are exploring hybrid arrangements. The Productivity Commission Australia says while working from home during 2020 and 2021 was not typical of working from home prior to the pandemic, it was better than expected for many, and attitudes and norms have changed. So what begun as a forced experiment catalysed by COVID is now moving into an experimental phase as companies and their workers try to see what works best for them. So what does this mean for public health? Various reviews of working from home or flexible working arrangements and employee health have shown some positive health benefits, including reduced working family conflict, reduced absenteeism, better psychological health, and in some cases better physical health, including increased fruit and vegetable and cooked food consumption. Negative impacts on health have also been reported for physical activity, sleep, snacking, alcohol and smoking since the onset of the COVID-19 pandemic. Some of this will be related more to the pandemic than to workplace setting changes. So we need to know more about employees working from home situations outside the parameters of the pandemic. A large area of concern highlighted in a number of studies before and after the COVID pandemic learning is that of physical activity and sedentary behaviour. Some estimate that office desk-based workers in Australia pre-COVID spent over 70% of their day sitting. Some studies have shown changes in sitting pre-post-COVID of 2 to 30% increases, but the variance in reporting changes has made this challenging to confirm. Pre-working from home physical activity from the trip to work and incremental activity accrued around the office was contributing to total physical activity of the working population. This incremental activity has many health benefits. An active transport to work, whether walking and cycling or taking public transport, has been shown to prove sufficient activity in a week for people to meet their recommended levels of activity. But the question is, are workers switching their time they would have spent walking to, say, the bus stop or up the stairs in the office to now walking around their local neighbourhood? Or are we in danger of having a workforce with an even higher risk of NCD burden due to even low amounts of physical activity? So I'd like to present some research exploring the impact implications of working from home and changes in transport-related activity. The data comes from my Sydney Travel and Health study, which commenced in 2019, initially to examine changes in health behaviour associated with urban infrastructure changes. With a group of transport researchers from the University of Sydney, I've been exploring changes in health behaviour, including physical activity, sedentary behaviour, and how we interact with our local built environments, and now in relation to work environmental changes. An online survey data was collected from a sample of residents across Sydney in late 2019, again in late 2020 and 2021. And the graph shows when the data was collected in relation to the lockdown measures. And overlaying this is Google mobility data showing population changes in mobility around the train stations, workplaces and residential areas as they fluctuate with these changes. These are some results comparing data from 2019 to 2020. Before lockdown, 12% of our sample worked from home, but by 2020, 58% of workers in the sample reported that they worked at least one day a week from home, and those working fully from home tripled. The sample was fairly evenly distributed in terms of age and gender, but we oversampled office-based workers intentionally. In 2020, we asked a series of attitudinal and perception statements about what participants thought they had changed since the pandemic. Overall, just over a third of the sample thought they were doing more activity than pre-pandemic, a third they were doing about the same, and just under a third thought they were doing less. Some reported an increased use of active travel modes for non-work purposes, particularly walking, and increases in walking or cycling for leisure and exercise. In terms of wellbeing, almost half the sample reported more anxiety or depression in 2020. We also recorded self-reported physical activity in minutes at baseline in 2019 and in the subsequent waves, using the Active Australia survey questions. We found no difference across the 3 years in terms of minutes walking or in moderate vigorous activity. However, compared to 2019, the proportion sample not doing 150 minutes of activity over at least 5 sessions of the week was significantly lower. So here people are doing less sessions. And this, however, was for the whole sample, and we're yet to analyse this in terms of those particularly working from home specifically. In the available paper, we present some analysis that looked at the association between perceptions about general activity or sitting and stress or active commuting with social demographics and reported health behaviours. And we found 3 clusters within the sample. Those in the smallest cluster we called the active but anxious. They were slightly younger, had higher household incomes, and reported the largest increase in working from home following restrictions, and reported sitting for longer periods of time. However, they're the highest level of physical activity, and we think this suggests that while working from home, they may have been more conscious of sitting and attempting to offset this with high levels of physical activity. Those in the second largest cluster, which we called the less change, less worries cluster, they reported less changes to stress, were predominantly male, and reported limited impacts on their work and physical activity between 2019 and 2020. This cluster reported lower amounts of sitting and highest quality of life scores overall. The third and the largest cluster are the ones that we are most concerned about. This group we call the stressed and sedentary. The population in this sample reported high levels of relative stress and lower levels of relative physical activity. The group reported sitting the most and reported insufficient levels of physical activity and lower quality of life. So what are the implications? Well, we're only beginning to analyse this data, and there's still more to explore, and we'd like to continue collecting data over time if fundings were available. If we're going to be working from home well into the future, then there are many implications for work health promotion around sitting and physical activity. And we need to develop some guidelines and policies around healthy working from home practices. Some of the research suggests health impacts seem to depend on various moderators such as demands of home environment, the level of organisational support, and social connections external to work. If people are working from home, there are many implications for urban planning, and public health needs to be talking to planners about designing local neighbourhoods to promote physical activity, build better walking and cycling networks. There's also more work for those of us in active travel to promote walking and cycling for other purposes if we're not commuting, such as a trip to the grocery shops to drop off the kids or off after school, or to go to the post office. We need to look more into the implications of working from home on the burden of non-communicable diseases into the future. And finally, I'd just like to acknowledge the team working on the project. Thanks for your time.